ABC stands for airway, breathing, circulation. After sanitizing the cut, you could put polysporin and a band-aid on it or apply pressure. 2 signs of bone fractures are bruising around the injured area or endoformity of the limb. 2 others are swelling around the injured area and loss of function in the limb. Fracture, for household items, you could use an umbrella and a scarf. Shock is a life-threatening condition that occurs when the body is not getting enough blood flow. This can damage multiple organs. Shock requires immediate medical treatment and can get worse very rapidly. Call 911 for immediate medical help. Check the person's airway, breathing, and circulation if necessary. Begin rescue breathing and CPR. Even if the person is able to breathe on his or her own, continue to check the rate of breathing at least every 5 minutes until help arrives. If the person is conscious and does not have an injury to the head, leg, neck, or spine, place the person in the shock position. Lay the person on the back and elevate the legs about 12 inches. Do not elevate the head. If raising the legs will cause pain or potential harm, leave the person lying flat. Give appropriate first aid for any wounds, injuries, or illnesses. Keep the person warm and comfortable. Loosen tight clothing. Oh my God! Checking the scene for any danger. Are you okay? Do you have any allergies? Do you need my help? I have first aid training. Call 911! God, do you have any spinal injuries? I'm going to wait until the ambulance comes.
In your seat.
To treat for heat exhaustion, you should rest in a cool, shaded area. Give cool fluids such as water or sports drinks that will replace the salt that has been lost. Salty snacks are appropriate as tolerated. Loosen or remove clothing. Do not use an alcohol rub. Do not give any beverages containing alcohol or caffeine. For treating heat strokes, call 911 immediately. Move the person to a cooler environment or place him or her in a cool bath of water, as long as he or she is conscious and can be attended continuously. Alternatively, moisten the skin with lukewarm water and use a fan to blow cool air across the skin. Give cool beverages by mouth only if a person has a normal mental state and can tolerate it. Hemorrhaging is when it's uncontrollably bleeding and you can't stop it. And bleeding is just when you can stop it. Okay, sir. Don't go close. No! No! It's gonna sting. All better. Pressure. The different
stages of frostbite are frost nip, deep frostbite, and superficial frostbite. Frost nip. Frost nip is least serious form of frostbite. Superficial frostbite. In superficial frostbite, the surface of the skin will feel hard, but the underlying tissue will be soft, allowing it to move over bony ridges. Deep frostbite. Deep frostbite is the most serious. Frostbite occurs when the flesh freezes due to prolonged exposure to cold temperatures. Frozen tissues, dead tissues. So frostbite is a serious condition that can lead to complications, including a gangrene infection, amputation, and even death.
In most cases of frostbite, only the skin is frozen, known as frost nip, but in extreme cases, dead tissue goes deeper and must be handled delicately. Serious frostbite requires immediate medical attention. Go.
Before
That's a blooper.
Okay, go.
Oh my god! Okay, that's
To make. Am I supposed to go first?
yes.
Okay. And she got my attention. You're bleeding. Ah! Meow, meow, meow. Meow. I gotta stop.